By bringing together the Parkinson's community, we hope to be able to understand better the hurdles that they still exist regarding Parkinson's disease, and then find ways to overcome the hurdles and to make the life of people with Parkinson's by tailored care much better, both for them who are suffering of the disease and their families and carers. The broad expertise of the team that we pulled together will ensure that we are going to have the right input in the projects and activities that we are planning.
One of the key objectives that would come out of this particular initiative would be a greater understanding about the different pathways of care for Parkinson's across the European countries, which might be very variable, about access to therapies, particularly advanced therapies in Parkinson's, which is of crucial importance to the people of Parkinson's and their carer lives. And then once this understanding becomes clear, it will allow us to form policies that will allow people to have equal care across the countries.
Well, I support this initiative because there are very big differences in quality of therapy and care for Parkinson's disease in the different parts of Europe, and this initiative has the potential to improve the situation in areas where it is not so good.
Parkinson's disease is one of the few neurological disorders where we can actively treat people who are affected. However, there are several hurdles that still have to be overcome, irrespective of the fact that treatments have been available now for more than 40 years. First of all, there is a problem with diagnosis, and many people not getting properly diagnosed simply because the doctors don't recognize that some features are a manifestation of the Parkinson, and they tend to attribute this to other diseases, so there is a delay in diagnosis.
Improving the qualities of the treatment is something that I'm working on an everyday basis. But it's not only getting new drugs or better treatments, it's also to fit these treatments with patients' needs and also make them accessible to the patients. So we have to work with patient associations, with healthcare systems and scientists to improve the global management and fit it to individual cases and needs. There are many challenges. We want to cure Parkinson's disease, and of course for that we need more resources. We need more resources for research, we need more resources for access to care, and we need more resources for training.
There are still many unmet needs in the treatment and in the care of patients with Parkinson's disease. Of course, we are not still able to halt or slow down the disease progression, but to do that we need the right drugs, the right approach, but also have access to very early diagnosed people.
I've been working with people with Parkinson's. I know them, I have a lot of experience, and I know that the knowledge is power. And I think that we have to unify our powers, and perhaps these new strategies will help in it.
I think it will be important to improve the conditions of life of those people, and therefore we need to raise the general public and political awareness of the effects of the disease on patients and their families and their carers. To be heard, patients and carers should raise their voices.